Trust Specialist Nurse in Infection Prevention and Control and Physical Health. I'm here to introduce you to a video that's been produced by NHS Test and Trace for all asymptomatic staff on how to complete a lateral test and what to do with the results following completion of this. I'd like to say thank you to all the staff for all the hard work and dedication that you've put in the last 12 months. And also, I'd like to say thank you for all your support in helping with the NHS, your colleagues and the patients in doing these tests, which will really help with managing this local pandemic and also nationally. At the Trust, we know this is a really anxious and difficult time for all staff, and we are really trying to ensure that your well-being is well supported. There are a number of resources that you can use to ensure that your well-being is well supported. These include things like staff support counselling and also the wellbeing offer from the Trust. If you need any help with accessing these, please speak to your line manager, and these are also on the Trust website. Just to point out, these tests are for staff that are asymptomatic, which means that staff haven't got any symptoms that relate to COVID-19, for staff working on the wards, so for patient facing, and also staff that are working on Trust sites. So in the following video, it talks about if you get a positive test on the lateral test, then you need to contact your occupational health and or your line manager to arrange a PCR test. When contacting your line manager, this is to offer any support that you may need, to report your absence, and also if they feel that you need a referral to occupational health for any advice. To book a PCR test, which is a supplementary swab following the lateral test, you'll need to go to a testing site in the community and also follow the Trust guidelines, which is to book an online appointment. This is a really exciting opportunity, and it's in advance of the up-and-coming COVID-19 vaccine. Recording your test results is really easy. Just scan this QR code or enter the website on this card. The cards will be in every box of swabs that will get sent to you, and please fill all the details on the website. Now, watch the following video or follow the online instructions to complete the test. Really big thank you for your support in this. If you've got any questions, please speak to your line manager or contact us in the RPC team.
Hello, my name is Eamon, Chief Nurse at NHS Test and Trace. I'm going to go through the instructions for using the lateral flow COVID-19 test. I will also give you some information on recording the test result. This video is designed for healthcare staff and clinical educators who are teaching technique or self-administering a lateral flow COVID-19 test. The test itself is quick and relatively easy to use. We will go through the use of the test packs, instructions for individual tests, and also the evaluation process step by step to make sure the tests are done correctly and that the results are as accurate and reliable as possible. So let's begin. Each member of staff will be issued with a pack. Testing should be done twice weekly, so you'll have enough kits for at least 6 weeks of tests. The pack contains the following: an instruction leaflet, foil pouches containing the test cartridge, a bottle with 6 ml of solution, extraction tubes and tube caps, sterilised swabs. There are a few things that you should be aware of before you begin for the test to be done correctly and in a timely manner. The test itself takes about 5 minutes, but you will need to allow another 30 minutes for the test results to come in. Please take a moment now to prepare for the test. Make sure the packs have been stored at room temperature. Do not put them in direct sunlight, in the fridge or in the freezer. For each test you will need one device, test solution, tube, cap and swab. Make sure you also have the instructions to hand. Before you start, blow your nose and clean your hands. First, check that the test is not out of date and the pouch is not damaged or the seal broken. Now, remove the test device from the foil pouch and place it on a flat and clean surface. Please remember that the test must be performed immediately after removing it from the foil pouch. Hold the solution bottle vertically and dispense 6 drops of liquid into the tube. Place the extraction tube in a clean, small container to hold it upright. Please be aware if the amount of solution is excessive or insufficient, an improper test result may occur. Now on to specimen collection and extraction. First of all, open the swab, avoiding touching the head of the swab. Tilt your head back. Insert the swab 1.5 centimeters or around ½ an inch into the nostril. You may feel a slight resistance. Rotate the swab 10 times slowly in each nostril. Insert the swab into the extraction tube containing the solution. Swirl the swab tip in the solution fluid against the wall inside the extraction tube, squeezing the tube from the outside. Now place the cap on the extraction tube. The solution bottle should be firmly sealed between each use. Once the swab is done, we begin the test process. The swab specimens should be tested immediately after collection. Dispense drops of this specimen vertically into the specimen well on the device. Do not handle or move the test device until the test is complete and ready for reading. Set a timer for 30 minutes. The letter C is the control line, meaning that the test is valid. If it is not there, the test is invalid and should be repeated using a new device. The T line indicates the test result. If it is present, the test is positive. A positive test will have two lines, a C line and a T line. If the test is positive, the member of staff will need to self-isolate and contact their occupational health department or line manager and arrange a PCR test. If the test is negative, continue with your normal activity, and if it is invalid, you will need to take the test again. Finally, dispose of the device, any liquid solution and the swab in the household waste. Now please remember the following key points. Read the instructions prior to performing the test. Do not eat or smoke while handling your specimen. Be careful not to splash the swab or solution. If you do have an accident, clean up any spills thoroughly using a household disinfectant. Do not ingest the solution, and store the extract solution as recommended out of reach of children and animals. Thank you for taking the time to watch this film. If you do need a little bit more help, please don't hesitate to contact your local representative. Thank you.